News Radio 700 WLW.
A lot of states, including Ohio, are not doing a very good job of getting vaccines out of a vial and into your arm. And why is that? Why is that? We've known this vaccine has been coming since May. People guffawed and laughed at Donald Trump, but Donald Trump delivered. There is a vaccine now that's out there, and in this state at least, if you're 60 and older, you're eligible now for a vaccine. It took a while. There was no website until a couple of weeks ago for you to go and sign up. You were left to your own devices, but you can go now. But why are we only 32nd out of 50 states in one district? Standing by to talk about that is somebody who probably knows all about these things. He is the author of the book, 60% Solution, Rethinking Healthcare. Rethinking Healthcare. Who does not want to do that? Todd Furniss has over 25 years of global experience in private equity consulting and operations at a senior level executive position at various industries in the healthcare industry. We welcome him in. Todd Furniss, how are you on this glorious Saturday?
I am fantastic. Thank you so much for having me, Ken. And I think that the one thing I would wish for is that everybody would perhaps get your craftsman buddy to attach their energy levels to you. You've clearly got a high energy level, and I think they're helping you in more ways than one. Yeah,
you never know where that wire went when they were in the house the other day. We're 33rd. We're 33rd out of 50 states in one district. We have been distributed, according to this information that I have in front of me, that was, this is Becker's Hospital Review. It was as of March the 12th, so not that long ago. We were 33rd in the country here in Ohio. We had over 4.5 million doses and only 3.3 administered. That's about a 73% percentile, which is not bad. 73% got you from one grade to the next in elementary school. But that seems to be a really bad number. It should be higher than that. Why is it not higher than that, in your opinion, here in Ohio?
Well, when you think about it, first of all, you're kind of in the middle of the pack. I saw the same report by Becker's, and Becker's does a great job with information on the industry. But what's interesting to me is that we really haven't put logisticians in place in the state level. So the government makes a decision on policy. They help get the vaccine produced and manufactured and distributed so that the states can then get their allocations. But it's really left up to the states, who are not really fully equipped to handle this kind of a problem. And what you saw in the president's address the other night, which was startling on many levels, more because it reflected a very significant pivot in the policy that's being undertaken by the administration, meaning rather than go after those who are most vulnerable, we're now pivoting to kind of saying, hey, we want everybody to get it. And that creates a whole bunch of other issues. For example, what about people who are like women who are thinking about having babies or who are pregnant? How do we handle that cohort? There are lots of issues associated with this, and if we had taken this approach in the beginning, maybe we'd be in a different place. But at the end of the day, we just don't have the tools necessary at the state level to effectively distribute. We really need to be doing is relying more on private sector solutions for this than we have been.
Well, I agree 100%. Indiana is 16th on this list, and Kentucky is 22. As you well know, Ohio, Indiana, Kentucky comprise the tri-state here. But I'm surprised as well, and I'll tell you why, Todd. When I think it was in June, maybe it was earlier than that, when there was a Rose Garden event. President Trump was still in office, and he had people from CVS and Walgreens, the major drugstores in this country. And I thought, okay, well, he's going that route because, let's face it, when people need a flu shot, invariably they go to CVS or Walgreens. But it didn't happen that way. What happened, because it was still under Trump's purview, what happened, why did it become the business of the state to deliver this vaccine to people? Why was it not delivered to private equity, in your opinion?
Well, private industry should have gotten it earlier, and the issue is, I think, the coordination between the federal level and the state level, and depending upon the politics of the state, you had different ambitions there. And I think people were playing very, very fast and loose with the health of Americans by prioritizing politics over the health of Americans. So I would have liked to have seen this get into the private sector much more rapidly. And I'll tell you a quick story that's unheralded, but one of the guys who's really responsible for making sure we have as many vaccines available as we do today is a guy named Senator Steve Daines. What Senator Daines did is he said, hey, we need to make sure we de-risk the production of the vaccines. And so what that did, what he did is he put federal money behind that. So he said, we will cover the cost. So even if the vaccine doesn't make it through the FDA trials, we'll cover the cost of manufacturing the runs so that you're not at risk. That way we can make sure we get those vaccines out faster. Just imagine if Senator Daines hadn't taken that initiative. We'd really be in a world of hurt.
Yeah, Senator Steve Daines, the junior senator from Montana, and you're right, he was at the forefront of that. You know, watching this the other night, on Thursday night, and I see the president say if we stay vigilant and if we don't stay vigilant and conditions change, then we may have to reinstate restrictions. In other words, a lockdown. Lockdowns don't work. I mean, it's well documented. They don't work. The reason why this thing took effect, this virus got feet and got legs is we never saw it before. It didn't. It was a different strain. It hit us. It was a sucker punch. And okay, so it took time, but we got this vaccine out quickly, and because of that, everybody was, I think, very much in play as to what was happening. Masks, social distancing, wash your hands, don't gather in big groups. I think everybody was on board with that. But if we go back to lockdowns, I think he loses. I think he loses this country, because it's one thing to say it, it's another thing to implement it. And I think, as I said, I don't know if you heard in the intro, Cincinnati, I think, is a lot like a lot of cities. It's not a city, it's a bunch of small towns that make up a city. And I think people just throw their hands up in the air and say, to hell with it. We gave Mike Pence his 15 days twice. You know, we gave the previous administration until December. They got the vaccine out. Now this guy's going back to lockdowns. I think he loses. What do you think?
I think you're right. And if you take a look at the tale of two cities, California, two states, if you will, California, where Governor Newsom is facing a recall effort, versus Governor DeSantis in Florida, who is being heralded as, you know, a great leader in this fight, it kind of highlights the issues you're addressing. So you're spot on.
Todd Furniss is our guest. Todd Furniss is our guest, and we're talking about the president's speech on Thursday night. We're talking about the vaccinations. You know, it's interesting. You made a point here a couple of minutes ago, Todd. You say, you know, it's an interesting pivot where we've gone from the most vulnerable, now we're pivoting to everybody 18 and up by May 1st. You and I both know there is a large section in this country that either won't or can't get a vaccination. We have a homeless problem. I don't know how you track down people to give them one, if not two, vaccinations. You have people, as you mentioned, women who are thinking of or in the process of having a child, and you have people that just don't want to get vaccinated. If I'm 18 years old and somebody tells me the chances of me dying from COVID are 0.005%, oh, by the way, try this vaccine that has 96% efficacy, I'm looking at them like, well, if that's the chances of me dying or getting hospitalized from this disease, why would I want to put a vaccine in my arm twice and suffer the side effects from such? I just think that we're going to get to a point, and quickly in this country, if these vaccines are as prevalent as what the president is promising, that we're going to reach a point of just diminishing returns. I think you reach 70% maybe, 65% maybe, and I think you may have trouble getting that final 30 to 35% vaccinated. What about you?
Well, let me start with the fact that you were much smarter and more analytical than I was when I was 18. When I was 18, I still believed I was immortal. I wasn't disabused of that belief until I was probably 40 when my brain started fully functioning. Yeah. But, I think you're right. I think that here's the other issue with this. If we had started with the policy perspective that we're going to hand out vaccines to everybody in the country over 18, that's one thing. But starting with the position that we're going to address those who are most vulnerable is a different. And if you look at it, what we've done is I think we've kind of politicized that as well. If you think about who is a strong voting base, folks over 65. And so they were saying, hey, we're gonna focus on the 65 and over. Well, the reality of the matter is, yes, the elderly are more vulnerable, and I'm soon to be in that category. But the real issue is, as highlighted in the CDC report that came out last week, 78% of all patients who have been hospitalized, intubated, or died from COVID were obese. 78%.
Wow.
Were obese. So if you really want to tackle the most vulnerable, you don't go after the aged, you go after the obese. And that's a topic, unfortunately, the nation just doesn't want to address.
Right, because, well, let's bring it right down to vernacular. Nobody wants to be told they're fat. And you tell somebody that, then you've got all kinds of other problems. I mean, if you're running around trying to chase people that are obese, then they're tagged with something they don't want to be tagged with. But still,
right.
I don't, I mean, if you, and I saw this, it was a study done, maybe you saw it too, at Johns Hopkins a couple of weeks ago. I forget the doctor's name. But he said we're probably right now at 55, maybe 60% herd immunity right now. Well, if the magic number is 70, we're not that far away, are we? And he reached, by, if you didn't see it, he reached that number by the number of people that have been vaccinated, the number of cases that have been diagnosed, and if you just do the math by, he had a factor. If you just do that by that factor, that we're at that herd immunity or very darn close to it right now. And I do think, to go back to the 18-year-old question, I think that's a major sell job for this administration, for this country, to tell somebody 18, 25, 30 that's in good health, hey, you got to get this vaccine. They may never get the vaccine. Hell, they might have had the disease and not even known about it.
You're right, and I've actually heard stories of, and I'm not making this up, of young people renting a house and having a COVID party where they intentionally catch COVID so they develop an immunity. And they're all kind of hanging out together to suffer through the 10 days or 14 days that they have the problem. But if you really wanted to solve the problem, I submit, and this is what I advocate in my book, is we need to really use primary care physicians a lot more than we have. The problem with obesity is not the fact that you're heavy or not heavy. The fact is all the correlated issues associated with obesity. It's the strain on the organs. It's a strain on the cardiopulmonary system. It's high cholesterol. All those things are complicating factors that this terrible disease called COVID just leaches onto and really makes a lot worse very quickly. So all of a sudden that taxes your system, particularly your cardiopulmonary system, the way you circulate your blood and you breathe, to really deprive your system of oxygen getting into the blood and getting to the organs so that you can live a healthy life. And if you're obese, you just don't have that functionality the way we would hope. And so getting ahead of that and at least reducing your cholesterol and addressing some of these other issues in a proactive fashion would go a long way towards getting that last mile.
Yeah, I mean, obesity, if you talk to anybody, you go to any doctor for any malady and you're obese, the first thing he or she is going to tell you is, you got to lose weight. We got to do something here to get your weight under control, because if we don't, and you just laid it all out, and a lot of it is cardiopulmonary, but there are other things too. I mean, there are kidney issues and
Sure.
whatnot. You're walking down a path to hell right now if you don't. The book is called The 60% Solution, Rethinking Healthcare. Todd Furniss, good stuff. Thank you so much for joining us, and good luck with the book, and stay healthy. And when it's time for you to get a shot, I know you will. Thank you so much for joining us.
Thank you so much for having me, Ken. Appreciate it.